بسم الله الرحمن الرحيم. Tuberculosis. Objective of our lecture: to define the tuberculosis, to define the causative organism, resistance of tuberculous bacillus, criteria and diagnostic element of primary tuberculosis, pulmonary tuberculosis, sequelae of primary complex, diagnosis of TB, prevention of TB, control of tuberculosis, dose therapy, and the WHO international standard for diagnosis and treatment of tuberculosis. Tuberculosis first is an infectious disease, maybe acute or usually chronic. Causative organism. There are two types of the causative organism: human type and animal type. Human type constitute about 90% of tuberculosis infection, while the animal type responsible for 10% of tuberculosis infection. Usually the animal type is from the bovis or from cattle. This is very important. But maybe from the bird, which is called the avian type, and maybe from the rat, which it is called the reptilian types. The human type cause about 90% of pulmonary tuberculosis and 10% for extrapulmonary, while the animal type, specifically bovis type, is responsible for 90% of extrapulmonary TB and 10% pulmonary types. Resistance of tuberculous bacillus. Usually the tuberculous bacillus have high resistance outside the body and remain viable in the dried sputum and in a dust for several weeks and several months, maybe reach 6 months and sometime for 3 years, when the tuberculous bacillus presented in damp slum area away from the current air. When the microorganism enter into the body for the first time, it is called the primary tuberculosis infection. The portal of entry is usually through the respiratory tract. As we mentioned before, that the human type is responsible for 90% of pulmonary tuberculosis, while the bovis type is responsible for the other 10%. Or maybe through the intestinal tract, usually from the bovis type, or through the infection of the tonsil, and also pulmonary tuberculosis respiratory types. The reservoir of infection is usually from man for the human type and from animal, specifically from cattle. Mode of transmission, usually through the direct droplet infection, when the distance between the susceptible one and the source of infection is less than 1.5 meters. Or maybe through the airborne infection, through the droplet nuclei from the dried sputum on the dust. Sometimes The pulmonary tuberculosis is transmitted through the contaminated articles like vomits and utensil of human being. Sequelae of primary complex, this maybe lead to the latent infection. About 2% of latent infections will be transformed to the active one, or maybe lead to the progressive active tuberculosis. Sometimes healing of primary complex. Sometimes due to the decreased immunity lead to the flaring up of primary complex. Or reinfection, which may be exogenous or endogenous. Clinical picture of tuberculosis resembling any acute or subacute or chronic symptom and sign of chest problem in the form of acute cough like the acute bronchitis, or chronic productive cough for the chronic bronchitis, maybe lead to the wheezy chest like bronchial asthma. Tuberculoma, which is a space occupying lesion resembling carcinoma of the lung. Benign, sometimes resembling the benign or malignant tumors. Maybe lead to the lung collapse, resembling the collapse of the lung. This is very important at atelectasis. Maybe lead to the shortness of breath and dyspnea, resembling any acute or chronic chest infection or chest disease, and so on. So, tuberculosis should put it in differential diagnosis with acute or subacute or chronic chest disease, specifically when we try to treat for about 2 weeks without response. Diagnosis of tuberculosis is usually through the symptom and sign, which is the clinical pictures. Low-grade fever, night sweating, loss of body weight. This is general signs. Or maybe through the chest sign like dyspnea, cough, hemoptysis. Sometimes we use the chest x-ray, usually the posterior anterior view and lateral view, for screening of suspected case or investigation of suspected case. And the confirmatory test is usually through the sputum examinations, which is a smear analysis or smear and cultures, usually 3 consecutive smear analysis and smear examination. Susceptibility for the tuberculosis. First of all, socioeconomic susceptibility. Secondly, personal susceptibility. And thirdly, pre-medical condition, which is called the reinfection predisposing factors. Socioeconomic, the tuberculosis is classified as a social disease because the low socioeconomic condition affect the occurrence of tuberculosis, and tuberculosis lead to the degradations of the socio-economic condition of the person infected by the tuberculosis. Why socio-economic affect the occurrence of tuberculosis? Because low education lead to the unsound health behaviors. bad housing condition, specifically in the slum and slum area, away from the current air and sunrise, with overcrowding, lead to the occurrence of tuberculosis. Besides the decrease the income, which lead to the decrease healthy food consumption, and the protective and the preventive measures against the tuberculosis. Also, the tuberculosis itself lead to the degradations of the socioeconomic profile of the person through social breakdown syndrome, lead to the divorce. Daughter and son leave the school education. Treatment itself need an economic expenditure, and so lead to the degradation of the socio-economic profile. Besides, tuberculosis need to treat it for a long period of time, and this person take his income from the daily salary base, and so affect the salary and the income of all family. This is very important. Personal risk factor, usually tuberculosis affects the very young and very old age, while the adolescent between 5 and 15 years is called the golden age of tuberculosis. It is very difficult to affected by the tuberculosis in that age group. There is no sex difference between male and female, but usually the tuberculosis affect male, not due to the biological difference, but usually due to the overactivity of male more than female. On the other hand, the high-risk group, including the pre-medical condition, which is called the factor predisposing to infection. All disease affect the immunity of the personnel, like diabetes, chronic disease, cancer, stress and fatigue, corticosteroid and immunosuppressant, heavy manual workers, medical and paramedical personnel due to the certain occupation, farmer and agriculture, contact with animal, specific the cattle, employee giving the public service, and the restaurant, cinema, theater. The type of immunity against the tuberculosis is permeation immunity. Mortality on the hospital usually measured by the case fatality rate. And presented per 100,000 population. Prevention against the tuberculosis, there is a general measure and specific measure. Usually the general measure include the socioeconomic development, sanitary living condition, good housing, adequate ventilation, adequate space and avoid the overcrowding in the house, health promotion through the health education, nutritional support, sound health behavior, exercise, sport practice, health education. Why the specific prevention through the vaccine and the chemoprophylaxis? Usually the vaccine by BCG vaccine. There are two types of BCG vaccine. Injectable one and another type which is oral one. Injectable usually take during the period 0 to 40 days after birth. 0 meaning that directly after birth. Why the early vaccination is taken? As the newborn have no immunity against the tuberculosis, because the type of immunity is lymphocytic immunity, and the T lymphocyte cannot pass through the placental barrier from the mother to the newborn. That's why. Usually, the BCG vaccine is taken intradermal in the subcutaneous, intradermally in the left deltoid region. There are 3 criteria for the intradermal injection. First, an angle between the needle and the skin 15 degrees. Local resistance due to the cutting of fibrous tissue septum of intradermal layers, and local bulge. The dose is 0.1 milli on the outer surface of upper arm, left deltoid region. Another vaccine, which is oral BCG vaccine, is given to the newborn by mouth, 3 doses on alternative day within the first 10 days after delivery. Usually, the delayed hypersensitivity or lymphocytic immunity develop after 40 days from the injection of vaccine. Usually the protective value from 5 to 15 years in some case. Complication of the BCG vaccine due to usually subcutaneous injection overdosage in the form of cold abscess, maybe sometime proceed to the tuberculosis, sometime lymphadenitis for the draining lymph nodes, while the other specific preventive measure usually is taken for the contact in the form of isonicotinic acid hydrazine. The dose is usually from 5 to 10 milligram per kg. Usually taken during the period of contact with the patient. Sometimes we give the combined vaccine and the chemoprophylaxis specifically for the contact negative for tuberculin test. Control of tuberculosis started by early case finding through the screening test, and also comprehensive medical examination, and the sputum smear, sometimes through the survey study. For the tuberculosis, we have to group risk group, as we mentioned, socioeconomic, personal risk factor, and a pre-medical condition. And another, which is called the dangerous group. Usually the person contacts a large number of people working at the public place, like cinema men, like restaurant workers. Control of case usually starts by the notification to local health authority, isolation in the hospital, sometime when the home is suitable. We can make isolation at home. Disinfection, periodic X-ray and sputum examination. Release when the sputum smear become negative for 3 consecutive smears. Usually we make a follow-up for the case treated from the tuberculosis for about 5 years. Some cases need the rehabilitation. We have 2 types of rehabilitation. Physical rehabilitation according to the lung capacity by physiotherapy, and sometimes rehabilitation by changing the nature of job. As usually the treated case from the tuberculosis maybe reactivate through a period of 30 years. And so avoid heavy exertion. This is rehabilitation by the changes the nature of job. Tuberculosis survey is carried out for particular group of community. The objective of tuberculosis survey to find out the magnitude of the problem, planning and evaluation and prevention of control program. The item of survey study, preparing the requirement of the study, investigation of group of community, personal and social data, examination of individual, tuberculin testing, mass radiography, sputum examination, statistical analysis, and using the collected data for planning of prevention and control of tuberculosis. Tuberculin test is hypersensitivity test. There are many types, including the Mantos test, injection of 0.1 milli of purified protein derivative intradermally in the anterior forearm. The reading usually after 48 hours to 72 hours in the form of area of induration. The reaction may be negative, positive, or doubtful. Negative when the area of induration is less than 5 millimeters. Positive when it is 10 and more. Doubtful between 5 and less than 10. Doubtful one should be repeated after 15 days by high dose. Indices of tuberculosis, including the prevalence of infection, annual infection rate, incidence rates, prevalence rates, case fatality rate, usually calculated by the number of deaths among a tuberculosis case divided by all cases of tuberculosis in the same hospital and multiply by 10 or 100 or 1000. It's very important. Also the mortality rate, also age and sex specific mortality rates. Lastly, the proportionate death rate. This is tuberculosis. Domiciliary treatment. This is meaning that treatment of tuberculosis case, specifically in a developing country at home, due to the limited number of hospital beds. Usually, the chest clinic takes its role for care of cases, provide the prescribed treatments, periodic home visits, and follow-up, beside the care of contacts, specifically chemoprophylaxis and contact tracing. Dot therapy is abbreviation of direct observed treatment of tuberculosis, where every patient come to the chest clinic and take his treatment in front of the physician or nurse to be sure from the regularity of treatment. The main criteria of dot therapy: patients are given 4 to 5 standard drugs for initial phase for about 2 months, and then continue treatment by 2 or 3 drugs for 6 to 8 months. The international standard for the diagnosis and treatment. The first standards: any person suffer from the chest complaint and not respond to the treatment for 2 weeks should be screened and investigated against the tuberculosis. Standard 2: all patients suspected of having pulmonary tuberculosis need to perform at least 2 or 3 sputum smear. Or the biopsy, or sometimes for the histopathological examination for extrapulmonary TB. All patients should be exposed to the chest radiography, 2 film usually, one posterior anterior view and the other lateral view. Smear examination should be 3 consecutive smear. One of them is early morning sample in 3 consecutive days. The treatment should be continued for 6 months at least.